All right, now we're talking about national health care, or socialized medicine. Ooh, socialized medicine. And it's a scary thing because then you have the government controlling your medicine. All right, I get to start this one. Although I took over on the reign anyways. But here we go.
Of course, you
personally, as someone who has tried to who buys his own healthcare outside of a company that he works with, and having looked for healthcare options in multiple states in Texas, Colorado, and Utah, I've had to buy health insurance for my family without going through work in each of those states. And actually, in Colorado, it actually ended up being the best. But really, it was a pain in the butt because it was a lot of searching and a lot of digging. And I spent a lot of time, and I'm still, I think right now I'm paying over $500 a month for health care for me, which is actually pretty cheap because the typical health care that you're getting if you're working at a company, you're making between $40,000 and $80,000 a year, and they're giving you health benefits. They're paying around, and you're paying maybe $250 a month for your family. They're paying. The total cost is between $700 and $800, sometimes up to $1,000, depending on the plan and so on. And your company is paying $500 of that $750. So if you're paying $250, they're paying $500. Or some companies do a split down the middle where they'll pay half and you'll pay half. So you may be paying $350, they'll be paying $350, something like that. Now, what was I going to say about healthcare?
Well, why don't we get to the controversial parts of it? Let's discuss why some are.
No, I actually had a point I was getting to.
Okay.
Fine, good.
Okay. Well, so this is what we need to look at. Now, the controversy comes down to competition. And the cost
I remember a point. Can I say my point real quick? Okay. I've done some work with government agencies and some of my consulting work, and. I actually can't say this right now. Go ahead, do your thing. I'll say this in
later. Okay.
Little while. What?
Well, okay. So the issues are the cost.
I know. I will say this. I take it back. I will say this. I would really like a national health care plan. I really would. My biggest concern is the way the U.S. government works. It's not always efficient, and sometimes it's the opposite of efficient. I mean, you take efficient, and you can find the U.S. government way over there. Sometimes, not all the time. They're efficient about some things, but a lot of times they're very inefficient.
Right.
And so, what I worry about is I do think there is a need for some sort of healthcare system to take care of all of us. But I'm scared that if we have the U.S. government do it, that they'll do a crappy job. However, I also worry about just doing it privatized only because the corporations are only in it for the money. I mean, we're there to make you feel better, blah blah blah. No, that's a bunch of crap. All they want to do is make money. They have stockholders, and it's a corporation's job. And it's a corporation's moral responsibility. If they have a moral responsibility, legal responsibility to produce profit for their shareholders. So if you have a for-profit company managing healthcare, that is their highest priority, and that's just the way it is. So you would need to either do one thing of, I'm taking all your time, I'll go quick, come up with a new entity that require any place that provides healthcare services to be a not-for-profit organization, but not just a regular 503 whatever nonprofit. There needs to be something new, I think, to handle all the intricacies of healthcare. Or if we do a national healthcare plan that's run by the government, great, but we need to let people opt out of it. The only problem, one of the biggest problems with Hillary's plan back years ago, and even the plan that Kucinich and Michael Moore are pushing now, is that it makes it illegal for you to go and get health care outside of the U.S. government.
So would you be for a nationalized healthcare plan, or socialized, however you want to call it, plan that allows people who have more money to opt out of it?
Yeah, it's the same with public education. If you're richer than snot, and you think your kids are too good to go to a public school, and you want to send them to a private school and you have stupid amounts of money, That's your
They
right.
can do that
I
now.
think,
So they
I
can do
think
that
you
now.
should be
So,
able to. And
you think it should be the same with
I
medicine?
think it's the same with medicine. If you're rich and smart and you want to go to some private hospital, which,
so you're not saying like give them their money back from their taxes on that. You're just saying fine, let them opt out and let them pay the extra money to go to. That's what you're saying? Okay.
if you want to, but they were making it illegal for a doctor to give you service outside of the government mandated system, and that I think is where they go too far.
So this takes us to the actual controversies of the issue. You've got two parts. You have the cost of healthcare now, and is it working and is it effective? And are the HMOs doing a favor to the patient, or are they just doing what their legal obligation
Some
is
are,
to their
and some
to,
aren't. That's
right,
the part.
right.
It's not consistent.
Or and that's part of the other part of the issue is can a socialized medicine have competition? Because that is what the claim is what makes our healthcare system better than others. Like the claim that you have to wait forever to get an MRI in Canada or another socialized country, whether it's true or not, is what makes the controversy about it.
Which brings me back to something I said before. I think that the for-profit thing is part of that for better things. So even though I'm saying we shouldn't, you want to take the profit out of it, but leaving the profit in is what's bred the competition to make it better.
Well, but the real competition, if you really think about medicine, the competition in the medical field doesn't really even happen at the business level. It actually happens between colleges and between institutions that are developing new drugs, new products for medical purposes, new ways of
that's all the pharmaceutical stuff, though.
Well, but the pharmacies just hire out universities. Like an example here in the West would be University of Utah.
So are you saying our medicine's better because of the drugs? Because you can get the drugs in.
No, it's not. But it's not just drugs. It's all of the new things that are found in medicine doesn't happen at just a lab or at a HMO. They actually happen at the university level.
Oh, you're talking about the studies in the colleges like at Princeton, Harvard,
Stanford. I mean, there's most of the things. Our advancements happen, or the local community colleges.
I'm
but the reality is the competition between these colleges that are competing for and these medical organizations between them, or is it between these HMOs? Because it seems to me, if you think of it from a business sense, that the businesses are just competing to see how much they can save. Can they save, between going to see a psychologist all the time and getting your mental health taken care of that way, or just here's some pills, and this $5 pill is cheaper than seeing a psychologist that costs $50 a time. I mean, how are they doing it? And I think that we need to really look at medicine as not just only as here's the problem, but we got to prevent things from happening and prevent future problems from happening. Can competition still happen? The question is, can competition happen in a socialized world or a socialized country? I think that's the biggest issue, because if you can overcome that issue, then and still allow, as you say, people to opt out and still allow everybody to have medicine, I think that would go a long way. I don't think we know. I think that's a problem. I think that's where the controversy comes in.
And
I think like we'll go back. I always mention Mitt Romney because he's a Republican. He was a Republican governor in a Democratic state who was able to do some moderate things and force people in that state, everybody, to get affordable health care.
Kind of like car insurance. Everybody has to have it.
Right. Does it work? Is it right? Those are the questions that have to be answered. I think we could do something, but I think it needs to be looked at, and I think again this is one of those complicated issues that we're gonna have to talk about in another video as well.